We're excited to bring to you in your homes or wherever you are, wherever you happen to be this evening, some great details about another great option for medical school. We applaud your investigation into all of your options. We encourage you to look at all of your options and to find what is the best fit for you. Tonight, I want to thank my colleague Sham Daria for being in the background. My name is Earl Maynor. I'm Senior Associate Director of Admissions, and Sham is Director of Enrollment Management. So I want to say thank you, Sham, for being in the background and manipulating the slides for us this evening. We also have a great list of two guest speakers that are very special, and they are one of our current students and one of our graduates that will be online to talk about their experiences and to share real life experiences that they've had as well. But we've also got some professors that are going to be online. I'm sorry, Sham, I'm jumping around. I'm sorry. With us, of course, one of our current students is Allison Ship. She's in her fourth year. And also one of our alumni, our graduates, is Dr. Holly Workus. Our faculty that's joining us is Dr. Craig Ayer. And Dr. Ayer, I believe you're online with us if you'd like to say hello.
Good evening, everybody. I'm glad you could join us this evening. So I'm Dr. Craig Ayer. I'm the Assistant Dean of Student Affairs on the island at UMHS in St. Kitts, and I'm also a professor of molecular sciences. So that means you see me a lot in the first 3 semesters of the program. So by training, I'm an immunologist who accidentally found themselves one day also being a geneticist. So I turn up in a couple of different locations through the program. I'm a Canadian, and so I'm also happy to talk to you what the experience is like coming down as an international student and living abroad for a couple of semesters with us. So thanks for spending part of your evening with us.
Excellent. Thank you. Thank you, Dr. Ayer. And thank you for your time because, of course, all of our panelists' schedules are very hectic, and we certainly want to thank them for taking the time out of this evening to speak with you and to present for you as well. We will also be joined by Dr. Matthew Michaud, and he will be joining us shortly in the program. Let's go back to our let's talk with Allison Ship. And Allison, welcome.
Hello, thank you for having me. Welcome everyone to the webinar. I think it's a great idea for you to join this evening. Prior to my enrollment at UMHS, I also joined webinars. It's a great way to get information about the program and to meet students and graduates that have attended this program. And as Earl mentioned, we can share our real life experiences with you. I am currently home in Memphis, Tennessee, studying for my Step 2 exam, which is the second board exam that we have to take to practice medicine in the US. And I'm happy to share my experience and answer any questions that you may have.
Thank you. Speaking of questions, we do want to invite you to feel free to put your questions into the Q&A box that you see on your screen. And behind the scenes, we will be answering questions as well. Now, Dr. Holly Workus, welcome, Dr. Workus. It's good to see you.
Thank you. I'm really excited to be here. Just a little bit about myself. I am originally from Michigan and I went to UMHS and graduated in 2017. I did my internal medicine residency in Chicago, and then I did my fellowship in hospice and palliative care at Vanderbilt in Tennessee. I'm currently double board certified in internal medicine and hospice and palliative care, and I've been an attending for 3 years now. I'm mostly doing inpatient palliative care. I work in the clinic 1 day a week, and I also do hospice. I also started an aesthetics company a year ago doing medical aesthetics like Botox. I am vice president of the Alumni Association with UMHS. So I had such a great experience with our school. I love being a part of these to really help give you all the knowledge that you need and help answer questions. So I'm really excited to be here.
Thank you. And I apologize, Dr. Michaud. Michaud, I believe you're online as well.
I am. Thank you. Folks, welcome. I am having a little trouble with my
There you are.
technology. Um, I'm glad to be able to be here to answer some questions about how our school gives support. I think as far as a medical school, we are as advanced as anywhere in giving support, in particular, giving medical education learning specialist support. And to answer any questions that I can about the main campus as well. I originally applied for a position as a learning specialist, is what I'd done at some other schools, and it happened to be in Maine. And I met the president and I said, "This is a good company." And so I am pleased to share some information tonight.
Excellent. Thank you, Dr. Michaud. And now our special speaker this evening is our president, President Warren Ross.
Oh, thank you, Earl. So I am very happy to be on this call tonight. I love talking about my university and all the things that we've accomplished. And what I generally like to do is kind of take you through the history of my history and how we got to this point and why we established UMHS, what our mission is, what's our goal, and what have we achieved, and kind of take you through the entire academic program. So by the time you're done, by the time we're done, you should have a really global perspective of UMHS. And once again, as Earl said, anytime you feel that you need to ask a question, please enter it, and then we have a number of people who can respond to you, and hopefully we can answer all your questions. So my history is unique. My dad and I established one of the first offshore medical schools called Ross University back in 1978. And at that time, there wasn't many alternatives to U.S. schools. Students could go to Mexico, Italy, Philippines, but there wasn't any Caribbean medical schools. And we started very small with a handful of faculty, a handful of students on the island of Dominica. And over a period of 20 some odd years, we built it into one of the largest Caribbean medical schools at that time. And we had state-of-the-art facilities, multiple state approvals, accreditations that are recognized by U.S. Department of Education, federal student loans, affiliations with over 40 teaching hospitals. And then at some point my dad said, I'm turning 80. I think it's time to retire. We're going to sell. So he sold Ross, and we he kind of kept an eye on what was going on in the Caribbean. And we realized that things were changing. Schools were being bought up, and the interest of the new ownership was more in the finances, and it was no longer focused on student and academic programs. And we felt that the quality of the education really was starting to go down. And my dad said, we need to give these kids an alternative. And a lot of these schools were bringing in, as many as 300, 400, 500 students a semester. And it's really hard to provide the resources and the quality education and the personalized education, which is really the backbone of what we have done at UMHS. So when my dad recognized that there needs to be an alternative, he turned to me and he says, okay, we have the background, we have the experience, we have the knowledge, we have the know-how, we have the funding, we can do anything we want. But this time, we're going to build towards a U.S. model in every way possible, including the facilities. I've built several schools now. I've been to all the Caribbean medical schools. I've been to U.S. medical schools, but this time we were building towards a U.S. standard in terms of classrooms, laboratories, library, learning resource center, anatomy lab. Every aspect of the university is state of the art. Um, and we knew that we wanted to recruit faculty primarily from U.S., Canadian medical schools, and other qualified medical schools throughout the world. And we recruited, highly competent, qualified faculty with the goal of, being dedicated to your success. And then we knew about the various accreditations that were out there, including because we've gone through multiple accreditations over a 40-year period of time. So we understood accreditation, what it would take to establish a premier medical school in the Caribbean. And we subsequently received all those various accreditations from ACCM, St. Kitts, various state recognitions and approvals. So we've met all those standards. So once again, we had the background, we had the experience, we had the knowledge, we know what we wanted to do. But the major difference, and if you're shopping around and you're looking at and comparing and contrasting other schools, the major difference is we're a small school. Generally, our class sizes could be anywhere between 50 and 100 students versus other schools that are, 300 and 400 students. Why is that important? It's the resources. It's what's critical to students' success. And those resources could be anything from counselors, advisors, learning specialists, faculty that are mentoring and tutoring and working with you. So in a small school environment, you can provide all those services that are absolutely necessary to be successful. And I believe that part of what is different about our school and other schools is that we probably have the lowest attrition rate in the Caribbean. And that's important because you don't want to start a medical school and attrit out after 4 or 5 semesters. And we know that many of the other Caribbean schools are seeing attrition rates that could be as high as 30 and 40%. So when I say, if you remember in your organic chemistry class, it says, look to your left, look to your right, you're not going to see that person next semester. I can honestly say when my incoming students join us, I say, look to your left, look to your right, I'll see you at graduation. That's what the difference is. That's if you're comparing and contrasting, that is a major issue. And the thing is, once you attrit out from these other schools, it's hard to get into another medical school. And if your goal is to become a doctor, you want to go to an institution that's going to support you. So really good, solid faculty. And what the other part that's really important is that when you start medical school, we monitor your progress all the way throughout the academic program. And after each block examination, any students that are at risk who would perform poorly are required to meet with the faculty member to go over the examination and develop an action plan to remediate any deficiencies. So that's another reason why our attrition rate is so low. And then they call in the various counselors and advisors that can work with you to ensure you're going to be successful. Traditional basic science program modeled after U.S. medical schools. But another variable that's really important is that we provide USMLE resources to students beginning in the first semester and all the way through. So you'll have full access to the capital material when you enter into the program. And that recently we now have affiliated with UWorld. And what's important is, and what's going to be very unique about about this affiliation is that we are the way we're currently set up. We have a review program in the fifth semester. That's after you complete your basic sciences in St. Kitts, you transition to Maine. And in Maine, you take Introduction to Clinical Medicine 2, and then a 16-week review program. But what we've done is we've now integrated the UWorld questions into the review program. We also are utilizing NBME self-assessments to see how you're performing to ensure that by the time you complete the program, you are prepared and ready to sit for USMLE within the first window. We also now utilize the CBSE, the Comprehensive Basic Science Examination, which is a mock USMLE, which you'll take at the end of the 15-week program. And that will ensure that you'll be successful on USMLE Step 1. But the major difference, and no other school in the Caribbean is doing this, is that we are also developing a review program in your last semester in St. Kitts. So you'll have 2 semesters of a review. You have 2 semesters of UWorld to utilize prior to sitting for Step 1. And the other important part is not only will you have the basic science faculty as part of the review program in St. Kitts, they are also now involved in the main program as facilitators and faculty members going through the U World questions with you on a weekly basis. So you'll have full access to the basic science faculty both in your last semester St. Kitts and also in Maine. And we feel that this is the most comprehensive review program you will find in the Caribbean. And once again, the goal is getting through the program, passing USMLE, going into your clinical program, taking step two. That's the goal in passing step two. So one of the things I like to do is start to bring in a couple people who could talk a little bit about the things that are important. I think I'll start with Craig, who can talk to you a little bit about the faculty. One of the things I will lead off with is that our students play a big role in hiring of our faculty. So initially, we recruit faculty that are highly qualified and competent. There's a committee that will review the CVs and meet preliminarily with any candidates. And if we feel that they are of the appropriate, we then send them to St. Kitts where they're reviewed and interviewed by their peers, and they're required to give a lecture to all our students. And then the students there'll be a survey and they will rank the faculty member in terms of their presentation, their PowerPoints, their how well they communicated, how well did they respond to questions, and a variety of other things. So at the end of the day, we evaluate the student's response versus the peer's response versus the committee response. And ultimately, our decisions are made to whether or not to hire the person. But at a minimum, they have to have a PhD in or MD. They have to have many years of experience teaching at a medical school. And so they have to be appropriately credentialed. Um, and the one thing that's really important to me is that the faculty really have to love to teach. They have to be good communicators, and they want to help the students. They're mentors, they're tutors, they have office hours, they're there for you. There is some research going on in St. Kitts, and we'll talk more about research later, but they're really primarily there to make sure that you succeed academically. And it's not only academically in the basic sciences, it's academically with regards to your licensing examinations. And that's why we started a review program in St. Kitts as well as in Maine to fully utilize our faculty and show their support for the students. So, Craig, maybe you can talk a little bit about our faculty.
Yeah, absolutely. I would be happy to. So, as President Ross was saying, the minimum requirement for being a professor at UMHS is you have to have your terminal degree. So that means a PhD or an MD. And we like to maintain a mixture of both at the university because it gives you the best of both worlds. So I'd like to walk you through exactly what that looks like. The very first thing that happens with anybody who's a prospective faculty member for us is they have to go through several rounds of interviews with our administrative committee and then a subset of our faculty committee before we even consider bringing them down to meet the rest of the faculty and the students. That can include also having to give recordings of their own lectures, their own teaching feedback. So we spend a lot of time making sure that these individuals are completely dedicated to the educational experience as opposed to some other aspect of their academics. So then they come down to the island and then have to teach in the classes where they hope to have to be hired. So, for example, when I did my interview for UMHS, I taught for 2 hours in cell bio, I taught for an hour in immunology, I taught for an hour in genetics, and all of those classes had to give feedback on the performance in those classes. And then only after that do they get to meet with the rest of the faculty members. So the students play an absolutely essential role in deciding which faculty members should be hired and how they perform in various classes so that we can make recommendations where they should be teaching and what their specialties should be. The other thing that we like to try to ensure is that you have as broad a perspective as possible while also getting a specialized teaching experience. And that's why we maintain a mix of PhDs and MDs. So, for example, I'm a PhD, and one of the co-professors that I work with is an MD. The two of us work together to make sure that the content of the course is aligned to the USMLE STEP exam. We make sure that it has the depth that's going to be required for you to be successful, not just to pass your exams, but also to be a good clinician. And then on top of that, we use it to make sure that we're focusing what we do on the practice of medicine. So that's common throughout the entire program to make sure that we are training you for exactly the role that you want to go into. So we have the perspective of the MD, we have the perspectives of the PhDs to make sure that your education is broad, but also very, very specialized. As a great example right now, UMHS is one of the only universities that still maintains an independent course for genetics. And that might sound like it's a little piece of trivia because genetics gets incorporated into biochemistry in most medical programs. But right now, the drugs that are coming online in the United States, the current generation of medications, are all genetic-based medications. So having to have a very, very detailed understanding about how genetics is employed in a clinical setting is such a tremendous advantage for students coming through our program. In fact, I think we're one of the only ones that still does this. So it gives you an absolute leg up on the individuals that you're going to be going into practice with and as you go into the STEP exam. So we take that perspective very, very seriously. Our faculty members are dedicated fundamentally 100% to their teaching and mentoring duties. Now, that's not to say there aren't research activities at UMHS, it's just they're designed around the teaching and learning experience. So, to give you some perspective about what that looks like, think about your average professor in an undergraduate course at the universities where you went. Generally speaking, they teach about 3 hours a week in their courses. They might have maybe one or two courses, so the average faculty member is teaching between 3 and 6 hours per week. That is not a lot of contact time. At UMHS, we teach on average about 3 times that level. So my students see me every day. They see me in multiple courses throughout the week. So they see me in 3 different courses through the week. That means that they get to spend a lot of time with me and I get to spend a lot of time with them. So we develop a dynamic as a class. This isn't an anonymous faculty student relationship. This is a genuine relationship, a genuine dynamic that builds over the semester. So my students learn how I like to present material, how I structure my lessons, the kinds of things that I'm going to highlight as being important. They know that I can bring in material from 4 or 5 weeks ago that we taught in a different specialty class, and now I can pull it in and tie it together in 2 or 3 other new contexts. They get to see how I write a significant number of questions. So students develop these relationships with all of their faculty members because the 3 times the undergraduate level is about average for us. On top of that, we maintain a 7 or 8 to 1 student to faculty ratio. So that means the faculty are very, very accessible to the student population. So here's what my day looked like today. So I come in the morning, I get myself set up, I get ready for class. My class is in the morning right now, so I spend my morning teaching. Uh, at lunchtime, that's usually where I schedule my meetings. So I'm also the Assistant Dean of Student Affairs, so I'm engaged with our clubs and societies, with our TA program. I do some liaising with our main review program, or for example, with external partnerships where we want to bring in expertise from other schools to broaden your experience. So I like to do that kind of in the middle of the day. After that, every day I have dedicated blocks of office hours. So I had an hour and a half of office hours today. So I met with 4 different students. I went through exam review with one of them. So I spent 40 minutes going through 2 exams with one student. We worked out every problem that she got wrong on the exam. So we sat there and we went through absolutely everything. I made notes so that she could take them away and study them for a personalized review system. When was the last time you did that with a professor? I met with a student from my genetics class who was having a little bit of difficulty on organizing some notes. And then I did a follow-up session with a student who came to see me from last week to make sure that we were still on the same track. So it's a very, very personalized experience for everybody that's involved. That's something that you do not get at larger schools. It's something that you often don't get in medical programs in the United States, because even though they will say they have a 7 or 8 to 1 student to faculty ratio, generally the way that they organize their courses is that they have a head lecturer, and that person gives all of the content in a classroom. Then they have sub lecturers or assistant professors who are assigned to different small groups. So you never interact with the person who gave you the lecture. You interact with a completely different individual. So you have to hope that they're completely aligned. Instead, with us, you get access to the person who's writing your exams, who's teaching your class, who's handling your tutorials. So I want you to throw away the concept that you have from your undergraduate experience, the way that you relate to your faculty. Medicine is a discipline that you practice. It's much more like a skilled trade because you're learning a set of skills and a set of knowledge that's very defined. So this is more like an apprenticeship. This is more like a mentorship. So we spend our time with you to help you develop that mentorship relationship. We model the direction that you want to be going in. So that is why we prioritize the smaller class sizes, the accessible professors, so that we can personalize your education. But it doesn't stop there. There are a number of other sources on campus with us for your educational support. So, for example, Dr. Michaud is our learning specialist at the main campus, but we also maintain learning specialists at the St. Kitts campus. They will help you with things like test taking strategies. They'll help you with test anxiety. They help develop timetables. They help develop more personalized skill sets. So they're accessible to all students. You can go on your own. You can be referred to by one of your professors. We maintain a robust teaching assistant program. So that's a peer-to-peer tutoring system. Our uh, upper class individuals will tutor and TA in courses where they got a minimum of a grade of a B. So that means you're getting a very intimate experience with what it's like to be a student and succeed in that specific classroom. And our TAs work with all of our professors to make sure that they're hitting the appropriate notes in all of their review sessions. In fact, I guess I can share this because I'm one of the ones who help administer that program, but we're talking about evolving our TA program on the island into a question-based review that's more aligned with the USMLE program, where we do even more question and review with you outside of the classroom. That bumps up the number of questions that you see in every semester while you're preparing for the step right from the very beginning. And then finally, all of our faculty members are assigned between 20 and 25 students as their individual mentees, where the goal is that you will always have access to an individual, whether it's an academic question, a personal question, some logistics that you need to work out. You know that there is a faculty member who is 24/7 available for you to reach out to. They know who you are and they're ready to assist with what you need. So UMHS is designed around this boutique, personalized, individually responsive education system.
Thanks, Craig. So as Craig was mentioning, it's just not the faculty that are engaged and involved with your success. It's the learning specialist. And as he said, they cover a lot of different areas, which could include time management, test taking skills, communication skills, writing skills, all the other variables that you need to succeed. And medical school is a lot different than undergraduate. The amount of work that you have is substantially greater than what you're used to. So it's important to develop the study skills that will last you a lifetime. To have these specialists there, both in St. Kitts and Maine, is really just really a great benefit to you. Matt, maybe you could tell us a little bit about what your role is like and what you do up in Maine.
Sure, please do. But one of the things that I do is I do reminders. I think that people have developed their skills well on the island. They've learned a different way to do time management. They have learned there's still only 24 hours in a day, so it's really self-management. But they have learned how to balance some time off and some time working. And one of the things that we find in Maine is that students go at a different pace. They're and it may not be so much the different pace, but they're doing two or three different things at once. They're doing preparing for a step exam, they're preparing for an ICM2 and clinical experiences. And they're also adjusting to a new place. And I like to give reminders. Many of the workshops that I do in medical education, students are getting PowerPoints all day, so I wanted to be very active and very hands-on and very experiential in the work that we do. And that's what I would say is we make everything experiential in the main semester. We have standardized patients that we work with, that they're actors, but they've really learned what the differential diagnosis is and what they're supposed to do to help the student. And this semester, we are working with our faculty on the island doing a bridge of how we answer USMLE questions in a group and learn from other people in the group how they take and dissect the question. And this becomes real important because one of the things that I work the most with students is they think they have to relearn everything when they come to a review period. And I think that knowledge has been very well developed in their brain, but their brain isn't quite prepared to quickly access it. And so what we get folks to do is to learn how to break down the question and think about where that information is stored. And as many times as a USMLE question is going to look at information, 50%, just like Dr. Harris talked about, 50% of those questions are going to be written by basic science faculty, and 50% are going to be written by clinical people. So if I'm in a subject like biochemistry, I want to be able to look for the clues that come from that basic science person and from that clinical person so that I open a door into what the author is looking for, because the questions aren't developed to trick me. They're actually developed to tell me exactly where I want to go and have the correct answer. And so sometimes we take our knowledge that we have developed already and we don't go through the front door on every question. But if I combine other subjects, I realized that I didn't know the answer from a pathology perspective, but I knew what it was from a physiology or a pharmacology perspective, and I get the right answer. My confidence goes up then when I do that. And so I'm constantly working with people in small groups and individually sometimes, most of the time, and in larger groups to really help them access the information that they already have. And we build an entire exercise and routine of how to do that as we prepare folks for step one. The learning specialists truly are, I say that we do jumping jacks and we do push-ups, the old-fashioned physical fitness. We don't do anything that's overly complicated. would get people back to their basics of what their brain already knows and help them prepare and not have a step one national exam become overwhelmed. Uh, and or be overwhelming. A number of schools that I've worked with, students come in a panic the very first day, thinking about step one is overwhelming. They know it's very important, but I think at UMHS, what we do is we break that. Motivation, anxiety, and reality about what step one is down into manageable tasks. And we work at it for so long, it becomes part of the routine. Ah, this is what medical students do. And the thing that I'm most pleased about that we do as learning specialists in Maine is that when a student comes in, they're not quite sure about how to break down questions and they're not sure really on which subject may be a challenge for them that they need to do more work with resources in. But by the end of 15, 16 weeks, they're completely confident in how to break questions down. They've learned a new way of learning and processing information, and they're clear on what the next step is that they need to do in order to continue to prepare for step one on their own.
Thank you, Matt. So we have the faculty that are dedicated to you. We have learning specialists. We have counselors. Um, we also, to ensure your success, we've incorporated into our basic science program the National Board of Medical Examinations shelf examinations. These are the same examinations students sit for if they attend U.S. medical schools. And what you're able to do is get a diagnostic result of your examination to see how you compare to your U.S. counterpart, so that you can work on any deficiencies that you may have when you sit for those examinations. Um, the other part that I think is really important, and Sean, if you can, just go through some of the images that we have of the campus. It really is probably one of the nicest campuses down in the Caribbean. We spared no expense in virtually every aspect of the university. Our anatomy lab really is a model for most U.S. medical schools. It's my third anatomy lab that I've built. This gives you a view from the administration building. There's a view of the anatomy lab. And you can see on one of the poles, you have places where you can place your computer. You have access to a substantial anatomical database. We use high resolution monitors by every cadaver station so that they could utilize PowerPoint presentations, or we have prosected cadavers with high resolution cameras above so they can focus on the areas that you're dissecting. We have a large number of TAs working in there, as well as faculty that are circulating in the anatomy lab. But what's really unique, and once again, if you're comparing and contrasting, the larger schools now do not have the traditional anatomy lab. They can't. It's just too many cadavers they would be required to get. So they've moved towards a computerization or plastinization. So you don't dissect in those labs anymore. And for people who are thinking about surgery as a residency in the future, I mean, to have the opportunity to dissect really makes a substantial difference in your training. So we're very proud of our lab. We're proud of our 6-to-1 cadaver ratio, which is what you would find at a U.S. school. We have two 50-ton air conditioning units that replace the air 24/7. So there's virtually very little smell of formaldehyde in the facility. And once again, it's really state of the art. We have a beautiful auditorium. We have, as you can see, the top left-hand picture is our auditorium. Once again, we use state-of-the-art audiovisual in all our classes, and which is really important because we most faculty, all faculty, utilize PowerPoint presentations in their presentations. That is copied onto the learning management system, which is cloud-based, so you have full access to that wherever you're located. You can download it and annotate it as you're going through the lectures and use it as a study guide. The bottom left-hand picture is one of two multi-purpose labs. The top right picture is one of the ARP classrooms, Accelerated Review Program, and the picture on the bottom right is our research lab. So once again, state-of-the-art facilities. We have a skills lab that is a virtual hospital. We utilize a lot of state-of-the-art technology, including iStan, as well as Harvey, which is a cardio machine that replicates virtually all heart sounds, and we create simulations for you to be able to diagnose and treat the patient. And then this is lab, which is utilized both in physical diagnosis as well as introduction to clinical medicine. You really start to fine tune your clinical skills. You work with professional patients. You work amongst yourselves. You have full access to both high fidelity and low fidelity simulators, and you also have access to the local hospital where you'll make grand rounds. So, and the other part is really important is that in the curriculum, all our faculty have now are required to integrate into their curriculum clinical material because we know that USMLE Step 1 is more clinical vignettes than it had been in the past. So that all throughout the basic sciences, you're receiving clinical material in virtually all basic science courses. But starting in the first semester, you will be starting to fine tune your skills, clinical skills, and physical diagnosis. Um, so once again, beautiful campus, state of the art, gorgeous library, comparable to what you would expect if you attended a U.S. medical school. Uh, a large number of or access to a large number of uh, library databases, significant amount of educational software available to the students, periodical journals, Access Medicine, and just a very large list of material. Um, so, and then if you get a view of maybe some pictures of the island, it's just an incredible place to live. I've been going down there since 1983 when I started my veterinary school. And I fell in love with the island, the people, extremely friendly. The areas where students live could be as close to the campus as well as in Frigate Bay, which is the tourist area that includes a lot of restaurants and bars and hotels and really nice housing. And that's a picture of the national park. For those who live in Frigate Bay and want to do a hike, it's a 7 mile hike to the end of the island. But if you drive out there, there's a couple of restaurants right on the beach that are beautiful. Our students go there. We usually have big parties at the very end. This is one of the nicer restaurants on the island. Good friend of mine, if you go there, tell Marshall that I sent you, and he'll make you probably the best meal that you've had in the world. And so it's just a really pretty place to live. Um, maybe Holly and Allison, maybe you could tell about a little bit about your experiences in St. Kitts, about the academic program, and what it was like to live down there.
Sure. I'll go first, Allison. You know, I got accepted into the extended basic science program, and I had never been to St. Kitts before. Actually, my first time on the island was for orientation week. And I will say you meet a lot of people on the airplane who are all going to the island to do the same thing that you're doing. It's to follow your dream to become a physician and practice medicine. So right from the beginning, you start meeting people, and President Ross does a great week orientation where you're figuring out where the grocery store is, meeting your classmates, meeting your um, professors. President Ross comes down there too for orientation week. So for me, my transition to the island was pretty seamless. That's a great picture from one of the welcome parties. This is really the best time to meet your future study partners and your lifelong friends. I've one of my friends I met in St. Kitts actually, married me and my husband in our wedding. Like these are relationships and bonds that you create because you're going through the same thing and you have the same passion in life. So it's a very, very unique and cool experience. The restaurants are great. Like President Ross says, bottom right is a sushi restaurant called Rituals. And then there's just bars and restaurants. And while we are on the island studying all the time, there are still recreational things because mental health is important. There's soccer, volleyball, where you're playing against the other vet school, the other medical school or vet school on the island. So it's a really great way to keep your mental health and to be outside. Since I graduated from UMHS, I know the students wanted a basketball court and a gym, and all of these things were brought up to President Ross's attention, and now they're on the campus. So I think that's pretty remarkable that you have a president that listens to students and what their wants are to make their experience better. But yeah, I had a great experience. My parents' concern going down to the island was, is this safe? Is this a safe environment? You know, I was leaving the country. But I will say I always felt safe when I was down there. You have campus has a security hut. You have to show your ID to get on campus. And I thought it was a great, safe environment to study medicine. So I had a great experience. I don't know if Allison's on, if she has anything to add.
Yes, I completely agree with everything that you said. And so I remember when I arrived to the island, so I came to UMHS as a part of the ARP program. And I have to admit, I was very nervous about traveling and living on an island alone. And my mother has been absolutely wonderful. She actually traveled with me. I like to say it was to help me carry my 5 pieces of luggage, but I think she wanted to make sure that the island was safe and that I would be in a great position there. And one of the things that really struck me was that when you arrive to the island, there is a welcome committee that meets you at the airport. And that was a phenomenal experience for me. Included in this welcome committee was a student representative. So I had a peer there initially to greet me. There was a representative from the housing department there, and they helped us load all of our items into the buses, took us to our apartments. The housing representative actually came into the units with us, did a final check, made sure we had all of our questions answered. And then once they dropped off all the students, they actually came back to pick us up and to take us to the grocery store that night. And that was one of the most impactful things that happened that first week because we were completely clueless as to how to get around on the island at that time. And so, as mentioned, there's a week-long orientation. President Ross is there. He speaks to the students. He meets your families, whoever you bring down with you. There's tours on the island and on the campus for your family members as well. And you meet the students, you meet the professors that are there moving around as well. So you get to form your peer groups, like was mentioned earlier. Also, one of the things that was really important is the campus has a shuttle system that runs every day. So there is a bus that will pick you up at your apartment in the mornings, take you to campus, and they have several drop-off times throughout the day. And you can also charter those buses as a taxi. So if you need to get around on the island, say someone sends you a package and you need to pick it up at the customs office, or you just need to do some shopping outside of the normal route to your apartment, then those drivers will actually take you back and forth and make sure you're safe and comfortable. So I can definitely speak to that. The campus is open until 11 p.m., I believe, every night. And a lot of students will ask if it's a 24-hour campus. It is not. And that's because they actually want you to go home and rest. They really do care about you as a student. They want you to get some rest when you can and come back in the morning refreshed. And so I often found myself on the bus at 11 p.m. going to my apartment after being in class all day and studying. And the bus drivers there would wait for me to get up to my third floor apartment. They would wait for me to get into my apartment and flick the lights to signal to them that I was in and safe. And that was another great thing that made me feel protected and cared for on island and being a student there. And Dr. Workus mentioned that you meet a lot of your peers. I met my best friend on island for orientation, actually headed to the Sunfest party, and we're great friends today. I was actually there to witness the birth of her son, and we support each other as much as we can throughout this time. So you really do make lasting friendships, life-lasting friendships with your peers. Another great thing for me was during the semester, as I mentioned, I started in ARP, and we'll talk a little bit about that program later. But one of the great things is that the professors, yes, they're there to teach you the content and to provide you academic support, but they also check in on you as a student. They definitely teach you about self-care and doing things to take care of yourself and keep you motivated. And I remember one time in particular where I just was not feeling my best. I think I was slightly overwhelmed with content and missing my family, honestly. And one of the professors pulled me aside and said, "You don't look like yourself today. Let's have a chat. Tell me what's wrong." And so we had a whole conversation about me being homesick, missing my family, and being slightly overwhelmed. And we discussed ways to set up a self care day. So once a week, I would have self care time and I would change what I did each week. So one week, it would just be taking Saturday morning to relax, listen to music, clean my apartment, meditate. And then the next week, if it was a block week, which was when we do our exams on campus, then I would finish my exams for the day and take the shuttle to Frigate Bay and go get my nails done and go out to eat and just relax. So the professors really are there to not only teach you, but to care for you as a person, and to make sure that you're safe and comfortable.
Thank you, Allison. So you finished the basic science program in either 4 to 5 semesters, depending if you're direct accepted or into the 5 semester EBS program. And we'll talk a little bit about what the difference is there. Allison also talked a little bit about ARP. We're going to cover that a little bit later when we're in the admissions section. So Allison, you can jump back into that again when Earl's talking about ARP. Uh, so you finished up the basic sciences, you transitioned to Maine, you've already taken ICM 1, now you're in ICM 2, you're fine tuning your clinical skills, you're in the midst of a review program. And as I said before, we give you all the resources that you need to perform well on USMLE, and we've probably developed the best review program of all the Caribbean medical schools. So, after you complete the 5th semester, you sit for USMLE Step 1. Upon passing, you're scheduled and placed into our clinical program. We're affiliated with currently 26 teaching hospitals throughout the United States. In your first year in the clinical program, you had to complete your core rotations, which are surgery, OBGYN, pediatrics, family medicine, psych, and that's a list right there. And then your senior year electives. So, a couple things. We're currently affiliated with hospitals throughout the United States, Canada, and Puerto Rico. We have hospitals in New York, Maryland, Michigan, soon to be Illinois, Wisconsin, Oklahoma, California, Florida, Georgia, Puerto Rico, Canada. And in Puerto Rico, we're affiliated with Ponce School of Medicine, which is an LCME accredited medical school. Once again, if you're comparing and contrasting, there is no other Caribbean medical school that's affiliated with the U.S. medical school. They're LCME accredited. LCME is the body that accredits U.S. medical schools. Its real name is Liaison Committee of Medical Education, but everyone calls it LCME. Um, and they love us. The dean loves our students, and Puerto Rico loves our students. And one of the things that I can say unique about our student body is that those who are from Puerto Rico, they have an option to return back to Puerto Rico to complete their clinical programs. We have over 6 hospitals. Another thing that's uniquely different from all the other Caribbean medical schools, most schools either don't have affiliations in Puerto Rico or they may have one affiliation. We have at least 6 affiliations, and we're continuing to expand on that. As a result of those relationships, students have a unique opportunity for residencies. And what we're finding that's happening often in Puerto Rico, more so than the United States, is that students are being offered positions outside the match, meaning that they don't have to go through the residency matching program, which is typical of what you would do in the U.S. and the United States. And because they know the caliber and the quality of students, they know the reputation of UMHS, and we are really the kind of go-to school for students who are from that country. So So we're really proud of our relationships in Puerto Rico. And one of the things that may happen in the future is Ponce looks like they're expanding to Spain. So there may be opportunities for students to do some of their clinicals in Spain in the future. So we'll have to keep an eye on that, and we'll keep you posted as to how we're advancing in that area. So for your junior year, you have to go to our affiliated teaching hospitals. There's a set curriculum. It's continuously reviewed by our accreditors, as well as us. And and then in your senior year, you will do your electives you can either do it at any of our affiliated teaching hospitals, or you can go to hospitals that you're interested in doing residencies and showcase yourself. And all you do have to do is get permission from the clinical department to do a rotation there. And the benefit of that is that you get to go to the hospital that you're most interested in doing a residency, and those people at the hospital get to know you and see how competent, qualified, dedicated you are. And remember, at the end of the day, a residency is a job. So if you're competing against thousands of others who are applying for the residencies there, but they've never been there, they've never met anyone there, nobody really knows them, it gives you a leg up. And that's why, to date, 93% of our graduates have obtained residency since the inception of the university. So our performance is outstanding when it comes to obtaining residencies in the United States. And this just gives you a kind of a view of the various residencies that students are getting, but it's in virtually every specialty you can imagine. And we're really proud of our graduates. And Holly is the vice president of there, and we've gotten some recent stats that show that our graduates are licensed now in every state in the United States, uh, and uh, and they're just doing really well in terms of the placements. And this gives you an idea of some of the quality of the residencies they're getting in the hospitals they're going to. I mean, Mayo Clinic, Johns Hopkins, Vanderbilt. I mean, these are top residency, and you're competing against the best of the U.S. medical students. So it gives you an idea of how good you guys really are, and how well you perform. So a couple things, maybe Holly, and you could talk a little bit about the clinical program, how it prepared you. And Allison, maybe you could talk about that. You're currently in the clinical program, and how the fifth semester prepared you to enter into the program. Because the key is that, we want you to seamlessly transition between the fifth semester in Maine and the clinical program, because you're in there with U.S. students, and we want you to be able to compete at the same level and have the same knowledge and experience that they have. And I think that we've done a really good job at that. So maybe Holly, you could talk a little bit about that.
Sure. So I really enjoyed my fifth semester. I think this is everyone's goal going down to the island, is to make it to your fifth semester in Maine. My favorite part about the fifth semester was being paired up with a physician that you're shadowing. In your fifth semester of Maine, your main goal is to study for a step one exam. So you have the 16-week review course with Kaplan, where they actually fly in the professors. So it's in-person learning. So on breaks, they can help answer your questions. So not only are you doing the Kaplan review program, and you have the professional patients that it's you as a physician, a practicing physician, you have a professional patient, and then you have one of the instructors watching and critiquing you, but in a positive way, wanting you to be the best physician you can be, with appropriate bedside manner. And the clinical skills is awesome. What you learn there, you learn putting casts on patients, drawing ABGs, practicing intubation, CPR, ACLS training. All of this you're learning in your fifth semester. So when you do start your clinicals, which is essentially your third and fourth year of medical school, you've had experience. You've had experience in your last semester on the island on the hospital hospital on the island. Then you have your experience with your 5th semester in Maine because you're actually shadowing physicians. And then you're practicing, you're getting feedback. So by the time you're starting your 3rd year of medical school, where you're actually in the hospital doing your main rotations, which would be pediatrics, surgery, internal medicine, OBGYN, and family medicine. No matter what you want to go into in your career, those are the main rotations you do in your 3rd year of medical school. For me personally, I'm from Michigan, so I wanted to stay in Michigan, and I did my rotations at McLaren Pontiac. Um, I felt very prepared. We rotated alongside with students from Michigan State. I really do think that our students do well because we, for the most part, we worked really hard to get to where we are. We didn't take the traditional way of going to a U.S. medical school. So we're always showing up early, staying late, rounding on patients before our attending is even at the hospital. So I think doing all of these little extra things makes our students stand out. You can choose to do your rotations in the state where you are from, which for me was Michigan. But if I could do it again, I might have went to different states because nowhere else in your career can you do all of this travel. I did one rotation in Connecticut, or no, yeah, my psych rotation was in Connecticut. They had a really good inpatient psych rotation. So for me, that was a wonderful experience. They say if there's a specific hospital you really, really want to work at as a resident, because essentially, when you're a resident, this is your job. So if there's a hospital you really want to work at, you should try to do rotations there. But I will say that's not always the case because I did match in my internal medicine residency in Chicago, which was one of my top choices, and I had never rotated before. So another thing I'd like to say is the hospital I'm actually attending at now, Henry Ford in Detroit, did not have a rotation set up for when I was going through my rotations, but I had a physician that was willing to take me on, and the school contacted him, and they allowed me to do an OBGYN rotation with him. And I think he still does take UMHS students. So if you do have a connection and you see, could potentially get our students into a hospital, the school made that a really easy process for me to sign on for an elective rotation at a hospital that we hadn't worked with before. I will say all of the training that I did in Maine helped me pass my step 1 exam. So I think it was a really good experience.
I agree. My favorite part of the main semester was the clinical skills preparation. I think for me in Maine, this is when you start to feel like a doctor. Like you are done with your basic sciences, you're off the island, you're back stateside, and you're able to integrate all of the concepts that you've learned in basic sciences into clinical practice. And so when we were able to learn the material, to review it, and then practice the associated clinical skills, especially for like the respiratory system, when you learn to do the intubations and you learned why you use the capnography to measure your CO2, all of those things started to come together and complete the picture for me. And then I did also enjoy rotating in the community with doctors. I was with a neurologist, and neuro was never a complete interest to me. But after rotating in the neurology department, I became very interested in neurology and was able to see some really interesting patient presentations that I had only read about in basic sciences. And as far as feeling prepared when I started my 3rd year, I definitely feel that the training I received in Maine prepared me for my clinical years. A lot of the preceptors would comment on my ability to prepare a DDX list or differential diagnosis list. And that's because when we were in Maine and prepping for our OSCEs or our patient encounters, we had to do a full encounter with the patient and actually come up with a differential diagnosis list during that encounter. And that means you take a history from the patient, you do your physical exam, and as you're talking to the patient, you in your mind are making a list of potential diagnoses that this patient can have, and being able to do that and practicing in Maine, and then using those skills in real time in my 3rd and 4th year has been vital for me. And that goes with all of the other skills that we learn in Maine as well. As far as the academic preparation, we did have the Kaplan review course. I think it's very, very vital that they are now using the MBMEs to test your knowledge, because when you're studying for step 1 and step 2, outside of doing UWorld questions or whatever QBank you're using, the best way to test your skills is to use the MBMEs. These questions are written by the test writers that write the USMLEs. The vignettes are very similar to what you can expect to see on your board exams, and it's a great way for you to assess your knowledge. To get over your test anxiety, I realized studying for step 1 that I had test anxiety. And the more that I did MBMEs and practiced those types of questions, it allowed me to be more comfortable with the question writing and the answer option. So that was definitely helpful for me. When you go to your clinical years, you will rotate with not only other IMGs, but students from state schools. And I often get students ask me, did I feel prepared? Did I feel behind the curve? And I did not at all. I was definitely very confident in my knowledge base from basic sciences on the island and the wonderful review that we had in the main semester. And I was able to interact with patients. We, again, in Maine, learned how to do a full patient history, to do physical exams. And I was able to use all of those skills in my patient encounters and present patients to our preceptors, have a run in DDX list, and then even come up with a plan and assessment for my patient. And those are things that we learned in Maine. And I often noticed that some other students were not able to do that because they did not have the extensive training that we had in Maine. So that was a very vital point for us.
Thank you, Allison. So the last thing I want to talk about is our accreditation. So we have two major accreditations. One is ACCM, the other is St. Kitts. And the St. Kitts accreditation we had last one was I think 2023, and in order to be reviewed, you have a site visit by a review team that has experience in reviewing medical schools in the Caribbean. Um, and you have to provide them with a database document, a self-study. You have to respond to a number of questions. There's thousands of pages of documentation that we have to provide. And then they come to campus and they meet with faculty, meet with staff, meet with students, meet with the clinical department, meet with the faculty in the basic science faculty, the various committees that we have on campus, finance, provost, myself. It's very thorough. It's usually a 3-day site visit. And at the end, I'll tell you a funny story. We're sitting there and it's an exit interview, and typically they just tell you, where your deficiencies are and what you're going to need to do to improve. So the provost, myself, and the deans all picked up their pens and paper and started. It was prepared to hear what they had to say. And the site teams turns to us and says, "Put your pencils down." And goes, "This was probably the best site visit we've ever done. You have 0 sites. We think you're like the poster boys of of all the Caribbean schools. They should all model themselves after you. We think the quality of education is outstanding, but the most important thing they said to us, it was the administration's dedication to the students and their care and concern for the quality of education and the care and concern for the students that was really what moved them the most. So that means a lot to me in terms of just having an outside group review your program and speak that highly of the academic program. And then last year, we were also site visited by ACCM. This is a group that's recognized by the U.S. Department of Education through a body called the NCFMEA, National Council of Foreign Medical Education and Accreditation. And then the ACCM is a body of Ireland that's actually adopted the LCME standards of accreditation. LCME is the body that accredits U.S. medical schools. So both as written and applied. And they did a site visit, and we had to provide them with the same, documentation information that was required of St. Kitts. And once again, after a 3-day site visit, 0 sites. They thought the caliber and the quality of education was outstanding, and they once again reiterated our care and concern for the students was number one, and that was really the most moving thing for them. So that speaks highly to the education and shows to the world that not only do we have a really great academic program, but in every way comparable to a U.S. medical school because they're applying U.S. medical school standards to our for our accreditation. So that really says something about the quality of the academic program. When I say what they look at is every aspect, they're looking at everything from the caliber and the quality of the faculty, the curriculum, the various committees that are in place, the finance of the institution, the clinical program, and they are required to actually do annual site visits to all our hospitals to ensure that the clinical program is comparable to what you would expect if you attended a U.S. medical school. So that just speaks very highly to the quality of the education at UMHS. So at this point, I think I'm pretty much done with my part. Earl, you can jump into admissions at this juncture and take it away.
Excellent. Well, I tell you, I want to say that the panelists and President Ross, I mean, you guys are getting a full synopsis of what the experiences are, what you can expect, especially the quality of the program, the support that you'll receive. All of those things are so important and so vital to your success. So thank you very much. And again, the admissions process, we make it very streamlined. You can apply directly to UMHS on our website. We have our application, and you just simply upload the required documents into the application. And the way that you do include the MCAT is that you'll take a screenshot of your MCAT on your computer and upload the screenshot as well. Just a minimum of 90 undergraduate credit hours, which usually takes about 3 years. And people ask, is it necessary to have a bachelor's degree to apply to medical school? And it's not mandatory, but we encourage students to go ahead and get your bachelor's degree, enjoy your last year in college or at the university, and take some upper level sciences that's going to help you also in medical school. So we do encourage that. Just complete all the prerequisite courses that was covered earlier. And then, of course, the MCAT. And we get so many questions about what is the minimum MCAT score and what is the minimum GPA. And we do not have an official minimum score, but we do encourage students on the MCAT to just do your very best. Just prepare and do your very best as well. And then, of course, your resume, your CV is important as well. And your two letters of recommendation is preferred from two professors, science professors in your undergraduate. And if you're a non-traditional applicant and you've been out of school for a while, then we would accept two professional letters as well. As far as the MCAT, there is an asterisk there. I meant to tell you that if you are from Canada or from a country outside the US where the MCAT is not offered, then we do not require the MCAT for Canadians or for international students that did not have access to the MCAT. But it is encouraged. For the people in Canada, it is encouraged that you take the MCAT. It certainly can give you an added bonus as well. And of course, your personal essay on why do you want to be a doctor? Why do you want to be a physician? And just don't make it a novel or an epic writing. Try to be concise and to the point of what drives your interest and what type of doctor do you want to be? What do you envision yourself? The application is going to be reviewed by the admissions committee, and they make the decision on which one of our program structures is the best fit for you so that you can be successful. You know, in the States, you apply to medical school, it's either yes, you're accepted or no, you're not. And that's it. At UMHS, we have designed three different program structures that you've heard Allison and Dr. Workus talk about. And that is, of course, the three different options within the MD program, three different structures. And again, those are based on your overall application. Everything is analyzed and reviewed before they make the decision. Are you ready for the full academic load Monday through Friday? That's the regular med program structure called Med 1. That's your 4 semesters in St. Kitts, and then you go to Portland, Maine. The second option is, of course, the EBS or Extended Basic Science, and that is the same courses that's in the Med 1 program. It's the same classes. It's just that we stretch it out to 5 semesters instead of 4 so that you do not have a full academic load. This is extremely beneficial for students because not everyone enjoys or can deal with the stress of a full academic load every day, Monday through Friday. And this option called EBS, the Extended Basic Science, is 5 semesters in St. Kitts, and then you go to Portland, Maine when you complete those semesters. President Ross has designed this so that you don't pay extra for that extra semester. That semester number 5, you do not pay an extra semester. So this really illustrates that UMHS is student focused and not interested or focused on profits. And again, if your GPA is a little bit lower, maybe your MCAT score is a little lower, then you need the ARP program because you need to be entering medical school with a good solid foundation. And the ARP program is a 1 semester, 15-week program on the campus, and we also offer it online. The ARP program, again, is 1 semester to build stronger study skills, learn effective time management skills, and of course, you'll be able to take a sample of all the courses that you're going to be taking in medical school. At the end of that 15 weeks, if you've passed every class with a 73 or higher in every class, you're automatically accepted after the break when you come back the next semester. Automatic acceptance. No additional interview, no additional application. It's an automatic promotion. And President Ross also encourages students to do better than a 73. We don't want students to just pass. We want you to reach your full academic capability. So here's an encouragement from President Ross. If you pass all the classes in ARP with an 80 or higher, then you're going to get back about 90% of your tuition in tuition credit. That's an encouragement. That's a motivation to do your best because the better you do in ARP, the better you're going to have it and the easier you're going to have it in either the Med 1 or the EBS, whichever program you are promoted into. So in essence, UMHS is different because we want to fit you where you will be successful. We want to encourage you and support you so that you can be the doctor that you're dreaming to become, just as Dr. Workus has, and such as Allison Shipp is dreaming to be. So again, our program is very personalized. You're not thrown into a group and you're not known just as a social security number. You are known by your name. And as Dr. Aaron said, the professors know your name and you know their name. And it's a great, great professional relationship to be in. So again, those are the options, and we encourage you. We are accepting applications for this September and for January 2026. And if you apply now, you will be able to soon get a review of your application within probably 48 hours to 4 days. You'll get an email stating that your application has been reviewed. And if you're qualified for an interview, then your interview will be set up with you so that it's a convenient time and date. Your interview will be on Zoom. It's a one-on-one. And then within probably 7 to 10 business days, you will receive an email with the decision. We do not make you wait 4 months to 6 months with a decision. We are a well-oiled machine, and we are there to provide the information that you're looking for as far as with your application. Again, we are accepting applications for September and for January. The best time to apply is when you get your MCAT score. So if you currently have met all the minimum requirements and you've taken the MCAT, we encourage you to go ahead and apply. You know, some people self-select out or they have doubt, oh, my MCAT's too low, I'm not going to apply. I'm going to take the MCAT again. No. With us, we want you to apply and let the admissions committee make that decision. And if you are denied, the door is not shut and locked. The door is still cracked open because we will give you some advice on what you need to do to improve your application. And if you go back and you do that improvement and you've improved it enough, whether it's the MCAT or maybe it's some academic classes, then we will change, the admissions committee can change their decision. So apply now, and we will definitely provide you with the support that you need. Dr. Ayer?
Yeah, I actually wanted to chime in on that point because it's a little funny that you mentioned that, because right before I came on to this webinar, I received a text message from one of our recruiters who's out on the road and was looking at a student who had just been thinking about applying, but they hadn't applied yet because they had not quite sure where they wanted to recommend or what they wanted to talk about in their interview. So because I'm a faculty member who's on the admissions committee, they sent me sort of like a preview and said, I don't know how I feel right now with everything I'm seeing. If you had any recommendations for this student, what would you recommend for them now? So we actually discussed, even in advance of them sending in their application, ways that we can work with this student. And one of the things that I would recommend, exactly like you said, do your application when you've got your 90 credit hours, get your decision. That gives you a full year to do one of two things: either act on those recommendations, or two, sit back and enjoy your last year because you know your med school is locked in.
Absolutely. And that's why we wanted to educate the public that don't wait. Go ahead and apply. If you've got your MCAT and you've completed the prerequisite courses and the minimum 90 credit hours, then we can certainly take a good look and give you the answer on your application. So please go ahead and apply, and we will process your application as well. Again, I wanted to reach out as we're closing up here the webinar, just to reach back over to Allison. And Allison, do you have any last minute thoughts that, as you remember being in the audience and watching UMHS at a conference at your college, and you know what they're thinking, what they're feeling, you remember that vividly, I'm sure. What are your last words for these people?
Absolutely. I can remember the moment that I learned about UMHS, and it was actually Earl who presented the school to me in my master's program in Mississippi. And when I realized that a Caribbean school was coming, I thought about how much I knew about Caribbean schools and the medical educations that they provided. And I realized I didn't know much. And that was partly because you often hear people say, oh, you're at a Caribbean school because one, you could not get into a US school, or because maybe your grades, couldn't get you in, or you can't afford to go to an elite school. And that's really not the reason a lot of us choose to go to Caribbean schools. So I wanted to hear his presentation, know what he had to say. I did my own research, and I would definitely suggest and encourage you to do the same. That way, you know what the school has to offer to you, but you can also do some reflecting and know what you can offer to your program and how you can make the name of your program shine once you get into your clinicals and into your residency. And so I remember sitting in that room and listening and being terrified that the decision was here for me to decide whether or not I wanted to go to medical school, if I would apply to a state school, if I would entertain going to a Caribbean school, and what that meant for me. And so I made a pros and cons list, and I think that's a great option to figure out the best placement for you. I knew that I wanted a program that was smaller, that had more of a family feel, and that's definitely what I got at UMHS. I wanted a program that offered an ARP course or something very similar. And I wanted to know that I would have the academic support that I needed, that they would offer counseling, they had a mentoring program, and that I could do clinical rotations in the South. Being from Memphis, I knew that I wanted to be in the South as much as possible. And all of those things were available to me at UMHS. I also requested to speak to current students because it was very important for me to hear the information from a student that can provide a student's perspective. And so throughout my journey, I've also extended my services to other students. And I am the ARP student ambassador. I am also the student representative for the admissions committee. So I review the applications as well from a student's perspective. And I have students reach out to me all the time to ask what my experience is like at UMHS, studying for board exams, going through my clinical rotations, and even now in the process of preparing to apply for residency. So I definitely say take a hard look at your career path, what you want for yourself, what you would love in a school, and what you can offer. And then be prepared to have a serious conversation with yourself. I literally stood in a mirror, looked at myself, and had a hard conversation, because deciding to leave your home and move to the island is not an easy decision to make. It's gorgeous, yes, but you will be surrounded by other students that have the same goal as you. If you start in ARP, the goal is to finish ARP and be accepted into the medical program. If you start in EBS or med, your goal is to finish and be a doctor. And all of the students in this program are doing the same thing. We're all working toward a common goal. So it's important to have that conversation with yourself and with your support system at home. Help them understand what the transition will be for you moving to the island of St. Kitts, and what the support is that you will need from them to make sure that you're mentally prepared, that you're emotionally prepared to make this journey. So I support you in your decision. I am so happy that you took the first step, which was joining this webinar and getting a lot of great information. Again, I encourage you to continue to do your research, do your pros and cons list, and do not hesitate to reach out if you have questions or would like to know more about my experience.
Thank you so much, Allison. And thank you, Sham, for bringing up their contact information there, their emails. You know, one thing that Allison touched on is the sacrifice. You know, it is a sacrifice to leave home, leave your family, leave your friends, and go study medicine in St. Kitts. It is emotional sacrifice, but that sacrifice is the advantage. You're going away to study and to become a doctor. You're going to be responsible for someone's mother, someone's father, someone's son and daughter. Don't you want to be the best doctor you could possibly be? And so, by leaving home, leaving all of this distraction, leaving all of these distractions, and coming down to a beautiful, safe, high technology campus where professors, as you heard tonight, care about you and they support you. Can you imagine how much better you're going to perform than you did in your bachelor's? Plus, for the first time in your life, you're going to come to a campus that is only MD. The whole campus is only MD. That's another big advantage that we have at UMHS. So you feel connected, you feel part of a movement, you feel part of an empowerment that helps you step up automatically. You'll just step up. You can't help it. If this is your passion, you will step up, just like Allison and Dr. Workus. And so that's the advantage. Now, Dr. Workus, I'm sorry, I didn't mean to go on and on about that, but yeah, last words from you, please.
Sure. I would just say the sooner the better. It's a really long journey. You have 4 years of medical school, then you have residency, and then fellowship if you choose to specialize. So I took a year off, and if I could do it again, I would have applied to UMHS sooner, but I didn't know about it until I had already been working for a year. So you guys are in a great position to apply, and good luck.
Excellent. Thank you very much. And certainly, Dr. Ayer.
Yeah, thank you, Earl. So I just want to say thank you to everybody for joining us today. I hope we've answered your questions, but if not, feel free to reach out to absolutely any one of us who are on this webinar. We would be happy to discuss with you any further. But my advice comes to you as a guy who's a professor here on the island, who's been a part of UMHS for over 5 years now. Um, I did a similar journey to what a lot of you are thinking about. So I didn't know a lot about St. Kitts when I first applied for this position. And it's a transition to come down and dedicate yourself to something like this. No matter if you're a student, a professor, a family member that's looking into this, you are making a commitment into what your future is going to look like. So the reason I joined UMHS is because I was surrounded by a group of people. I met President Ross, and the entire ethos, the entire mission that was presented to me was, we want you to be a good professor. We want you to connect to your students. That's what we want you to emphasize. And to me, I'd been a teacher before UMHS. This is what I've been for my entire life. So somebody who said, we need you to come down and we want you to be the best professor that you possibly can be, was music to my ears, because it said, go do the thing that you love to do. So here's the thing. You're thinking about the thing you love to do. You're thinking about the vision for your future. And you're about to make one of the most consequential decisions of your life. Because as you move forward from here, you're going to shape the options that are available to you. You're going to shape the person you're going to become by the mentors that you surround yourself with. And you are going to be defined by the support system that you bring with you. So you're about to invest yourself into absolutely the greatest adventure you're going to have. Surround yourself with people who are going to invest with you. And so everyone around you should be putting as much work into you becoming a doctor as you are putting into it. And if that's not the case, that's not your environment and those aren't your people. Everything about UMHS is designed to get you there. From the school, the facilities, the faculty, your other students, your alumni, the administration. Everything is designed around getting you to that place that you vision yourself to be. So we know you're going to be looking at different options. We know you're going to be evaluating other schools, and we want you to take your time, do a good, thorough job, and pick the place that's going to support you to become the person that you want. I truly believe that UMHS offers you those options, and I hope to see you on the island soon.
Absolutely. Thank you, Dr. Ayer. And Dr. Michaud?
Yes, thanks very much for your attention tonight. I want to just summarize a couple of things. I think there's a micro and a macro level to applying to schools. It was said very quickly on micro, but we give you UWorld. I've never heard of a school giving UWorld question bank with access to prepare for step one. Usually that's an additional purchase. We give specialized, customized programs. We give individual attention. And I want you to compare apples to apples and oranges to oranges to the other medical schools that you're applying to. Are they able to support you on both a micro and a macro level? If I can help you clarify and oftentimes what I do with my work is that I talk about to transfer students and I help them understand what it is, the philosophy or the mindset of our program. I'm glad to do that. And I wish you luck in making the decision that's best for you.
Thank you. Thank you very much. And I do want to say thank you to our panelists tonight. Thank you for your time, taking it out of your hectic schedules to spend time with us this evening as well. And thank you, President Ross, as well for all of your support and all of the dedication and your last words, please.
So, once again, I really enjoy this. I love sharing, with everybody what our views and goals and mission is and what we've accomplished and our relationships and our accreditations and how our students are performing. I think it's a really good, we really have a phenomenal academic program. So I'm just going to leave you with a couple things to think about. What I've tried to do is to distinguish us between us and others that are currently operating in the Caribbean. And I think that the what distinguishes us and which it separates us from all the others: small school, boutique, personalized education, great faculty dedicated to you, resources that you need to succeed, small enough to be able to provide you with individual attention as you need it, access to the various USMLE review programs, including UWorld, MBME self assessments, comprehensive basic science examinations, shelf examinations, uh, unbelievable, outstanding, beautiful facilities comparable to that of a U.S. school, accreditations that prove how credible we are and comparable to that of a U.S. medical school, outstanding clinical facilities, little to no downtime in terms of placement and scheduling students for clinical rotations. And we purposely try to keep our tuition down. You know, I ran alumni organizations for 20, 30 years. And the one thing that you hear from the graduates is that the cost of education and how much they have to pay back. And we are and I purposely tried to keep our education down. But if you compare the cost of our education to others in the Caribbean, we could be as less than there. Other schools are 200, could be as high as $200,000 more than UMHS. So at the end of the day, remember, if you're borrowing, it's a debt. You got to pay it back. And there's some things that you probably may or may not be aware of, but the current administration is working on a reconciliation bill, and that reconciliation bill is talking about capping the Grad Plus loans for U.S. and Caribbean medical schools, those that are approved for federal student loans. And in some cases, they may even eliminate that in the next year. So be aware that if you are considering other schools, that there could be an issue with regards to financial aid in the future in these loans, because that's what U.S. schools as well as Caribbean schools rely on to cover a substantial portion of their education. We're affiliated with Sally Mae, and that's a private lender, and we feel it's a very sound program, and that's not going away. So just keep in mind, what's going on with the current administration, what's happening to the Grad Plus loan, and keep an eye on that, because whether you go to a U.S. school or a Caribbean school, it's going to impact both. So keep an eye on that. Anyway, I'm really happy that you were on this program, on this call. I hope that we answered your questions. You can see how passionate we all are about UMHS and how much we care about our students. And I'll leave you with a parting note. The first thing I tell students is that when you enter medical school, the level and intensity of your education is such that it goes by really fast. And in a blink of an eye, you're going to be on that stage at Lincoln Center, graduating with your MD degree and going on to a residency. So if UMHS is the place for you, I welcome you. I welcome you with open arms, and you can see me, how proud I am of my graduates.
That's right. President Ross is at every graduation, of course, and the graduation is every year in New York City at Lincoln Center, and it's such a beautiful venue to celebrate your great success as well. Again, we're accepting applications for this September. Get your application in soon, and we'll be able to process that for September or for January based on your timing as well. Please click on and follow us on all the social medias there that you see, TikTok and Instagram as well. That way you can stay up on what's happening at UMHS. We want you to come to UMHS. We truly care about each and every student, and we look forward to your application. Thank you, everyone. Thank you for joining us from all across the United States, Canada, and Puerto Rico. All of you out there, we want to say thank you, and we look forward to your application. Good night.